She says, yes. You've got to go, right? So I don't.
Thank you. Yes, I can't give it. I got a cookie.
It's just my. This is
What
what I
I
was.
was talking about. You want to know if they're about to give it?
Oh, yeah, yeah.
Close a while.
Actually, yeah. Did you a fish? I like that. Oh, you know, I remember
And they changed your menu.
so I was got my.
Oh, yeah.
How much next between food.
It's just on the stuff.
I wasn't.
I mean, that used to live there.
So they're going to Monday.
It does.
I'm gonna check that out. It's gonna be like 12 person.
I have very
But.
If you know where the next door is, yeah, it's a. That's what it is. Something really.
Yeah. Wow. Hi. Ladies and gentlemen, welcome to the October 18th meeting of the City of Charleston Planning Commission. My name is Charlie Carrick. I'm the chairman of the commission. I'm joined by Commissioner Harry, Vice Chairman Harry Hussein, commission members Jimmy Bailey, Donna Jacobs, Sunday Lemphasis, Erica Harrison, and McKenna Joyce. These folks are volunteers appointed by Charleston City Council. I know you join me in thanking them for their work and their time. The way we run the meeting today is I'll read an item from the agenda into the record. Then we'll hear from staff. And then after staff makes a presentation, we'll hear from the applicant. Then we'll hear from anyone that's supportive of an application, and anyone may have some opposition. Then we'll give the applicant a chance to reply to any concerns that were brought up. After that, we'll close the public hearing and it'll be discussed and voted on by commission members. If you have a phone, I'd ask you to turn it off or put it on silent. If you come up to speak tonight, I'd ask you to come to the podium, tell us who you are, where you live, and if you represent someone, we appreciate it. I'd ask Mr. Morley to introduce any staff members that will be presenting tonight and any changes to the agenda.
Sure. Thank you, Mr. Chairman. So I'm Christopher Morgan. I'm planning manager here at the city. Helping us out with the meeting tonight is our clerk, Philip Clapper. Natalie Creech from our legal staff will be presenting some cases to you all for ordinance amendments. Anna Hart from our zoning division will be presenting a subdivision. And Omar Mohammed is our key planning staff member. Working with the commission, and Philip Overcash is here. And then Molly Connor is our annexation coordinator who brings all these zonings to us.
Thank you, sir.
Oh, and then deferral. So we have under rezoning, we have 134 Columbus deferred. Also 162 Ashley Avenue is deferred. Under ordinance amendments, the number 4 Old City Heights Districts amendment is deferred. And then also under zonings, 1420 Drexel, that's number 17 under zonings, that is deferred.
Great, thank you, sir. And we're gonna get started. I'd ask anyone, because zonings are at the end of the meeting, and I hate for anyone to have to wait around if they have a zoning. Is anyone here just for a zoning issue? And if so, we'd probably get a motion to move that forward. If not, go with the agenda. Thank you. The minutes of July 19th. I'm always with Ms. Jacobs.
Mr. Chairman, I'll move for approval and
No changes?
no, I didn't see any changes unless somebody else picked something up. I didn't see any.
There's a motion by Ms. Jacobs, second by Ms. Lassane. All in favor, signify by saying aye.
Aye.
That's unanimous vote. Thank you.
Mr. Chairman, may I?
Yes, ma'am.
May I ask, before we see the rezoning number 2, I'd like to ask staff if the ordinance amendment number 3 has any application to that, and maybe we should see the ordinance amendment.
I think he's going to discuss all at one time, so we'll hear it all at one time, I believe. Let me read it.
It
into
only
the record.
seemed right to do them together.
Great. But I'm just going to read the rezoning into the record for now. Do you want me to read everything?
I mean, from a staff standpoint, I think we would recommend that the discussion center around rezoning number 2. And then the ordinance amendment number 3, and then also the zoning number 2, which is 3085 Maybank Highway, because those are all interrelated.
Okay.
And I'll kind of.
But we have to take them under separate motions.
It's separate motion. I think the discussion all is
Okay.
interrelated on that.
Okay, well, I'm gonna read number 2 into the record, which is 3037 Maybank Highway, and in 2021 and 2022, it's the Lasco Drive, James Island, TMS number 313-000-075, 313-000-0332, and 313-000-0335, approximately 20.42 acres, request zoning from Business Park BP, General Office, Mr. Morgan.
Okay, so what we've got tonight with all these applications that are interrelated is an amazing opportunity on Johns Island for a new medical center, hospital and medical offices. And the even better aspect of this is that it is very much in conformance with all the plans that we've had in place out there for almost 15, 20 years. It's in place with, planned road improvements and other things that are coming that will help make it an integral part of Johns Island. And so it's something that we are super excited about. We also know that there's a lot of timeliness involved in this because of some healthcare applications that the city isn't in charge of. That's a state level type thing. But the applicants will explain kind of the urgency of moving on this one. But the key thing to remember is that everything that's going to be asked for tonight is something that is very much in keeping with our plans, is going to be a tremendous asset in our view for Johns Island, and is something that is we as a staff would really recommend moving forward with in the path that has been set out for it as per your agenda. I will start off by kind of locating where all this is centering around for you. The first map that we have before you is the properties that are currently in the city that would be rezoned in this area. And these are kind of meandering group of properties that are between Maybank Highway and Kingslash. They are adjacent, and I'll show you a map of this in just a minute, to one of our 3 centers on Maybank, which was the key element of our Johns Island plan and is also reflected in our citywide comprehensive plan. So it's creating a key mixed use center in the exact right location that had been planned for it on Johns Island. It's also centered around some key connections, such as on this image you see on Velasco Road. I think Velasco Road runs through the middle here. This is identified in our Johns Island plan as a key connection to be created between Kingslash Road and Maybank Highway. In fact, this has been identified as a future signal location here at Velasco and Harold Arnold Way. So again, creating some uses here that would take advantage of that makes a whole lot of sense. I'm going to go to some other images. These are images from our comprehensive plan, and you'll see where these properties relate to the comprehensive plan. So some of it is in this more intense neighborhood edge area on Johns Island. Some of it is in the adjacent to city centers on Johns Island, which is one of the three centers on Johns Island. Some of the things that are a little bit further back from Maybank towards Kingslash were in what we call suburban. Not that suburban couldn't have uses beyond just single family houses, but that had always been viewed as a little bit less intense. The areas back behind Maybank going towards Kingslash. So again, everything that's been talked about so far is very much in keeping with our plan. This first item is an actual rezoning from business park, where a medical oriented business park had been planned and then ultimately was taken over by the applicant for the larger group of properties, which is HCA. This had already had extensive planning in the city, already had some design review board reviews, things like that. And this is just a comparison between the business park and the GO. Suffice to say, the business park is a little bit more light industrial oriented, and GO is much more oriented towards professional office and medical and things like that. Here again is an aerial image of the properties that are up for the rezoning. This is what I was referring to. This is from our Johns Island plan. And you see how we've got the three centers on Johns Island. The center at Maybank and River is here, and that is developing with some new mixed uses around Maybank and River intersection, and then the Maybank and Main and Bohicket area that has the incredible Angel Oak Park to one side, the city of Charleston's park to one side, and also our future rec center and our future aquatic center, assuming the bond referendum is passed. Those would be adjacent to that park. In the middle of this center, we also have libraries over here, schools over here, and commercial uses. So those two centers are very important. And now we have emerging along Maybank with this addition, a real key mixed use center along Maybank that would be involved in Live Oak Square, which is across the street. Other mixed development that is just come into the city just to the west of Live Oak Square, and then the medical complex that we'll be discussing tonight. So again, very much in line with all our plans here. So it's something that we're very excited about from that standpoint. Now, there's also, as part of this, bringing these properties in as general office, rezone to, annex to, and then creating an ability in medical office in general office, excuse me, to have medical centers or hospitals as part of the general office of uses. When we were first talking with HCA about this, and we looked at our GO allowances, we were quite surprised to see that hospitals weren't listed in the GO. With everything else about GO, typically it's about the professional types of offices. And what we have here is an image that shows where other GO is on Johns Island already at present. Those are the parcels in black. And then with all of the changes that are proposed tonight, GO would be added here in yellow as well. Then we have an image that shows where GO is across the city. Again, these were the ones we just looked at here on Johns Island. They're mostly in the West Ashley area, somewhat near the St. Francis Hospital in West Ashley, some even part of the hospital site there, but not with the actual hospital on it. So again, hospitals and GO seem to be synonymous, and that's one of the reasons we feel like making this amendment makes a lot of sense. And then some of these have not been developed. You have some on Glen McConnell Parkway that's here that's not developed at the West Ashley Circle, and then on Bees Ferry. And then you have smaller GO parcels that are along St. Andrews and Ashley River Road and Old Town that are typically medical offices, things like that. Also some office that is at the front of Citadel Mall, and then some offices that are on Holly Road on James Island. And then we also identified medical center downtown. Almost all of that is commercial designation. But again, the suburban medical center at St. Francis is a mix of GO and other districts. So our feeling on the ordinance amendment is it just fits right in with all this, that adding medical centers to GO just makes a lot of sense. So obviously, we're recommending for approval on this first rezoning. What I'd like to do is just zip ahead and show you the amendment or the rezoning that relates to the newly annexed properties. And so I'm going to go to that, and then we can read that into the record if you'd like, Mr. Chairman.
Yeah, I'm gonna read those other two items in the record as well.
Okay. So here we go. And this is, if you want to read this one under zoning number 2.
Yeah, so let me read the ordinance amendment in first, number 2.
Oh, yes.
Amend chapter 54 of the Code of City of Charleston zoning ordinance and definitions for residential accommodations use and under zonings number 2, 3085 Maybank Highway, 3075 Maybank Highway, 1810 Zalesco, 1838 Zalesco, 1955 Zalesco, 3046 Kane/Road, 3038 Kane/Road, and also it's identified by TMS on Maybank, Zalesco/Road. I'm not gonna read all the tax mass numbers, but after you're finished, when we finish, anybody who wants to discuss, we'll discuss all 3 items. So thank you, Mr. Moore.
Okay, and so to broaden out a little bit more, so this is the zoning for properties that would be annexed in the city, and these are designated crosshatch. These would also be brought in as general office. So everything here would be general office, all this BP would be general office, and then this area up here. So this would be the Johns Island kind of medical center area that would include this future hospital as well as other offices related to the medical center. So again, in reference to the plans that we were showing, it's in line with what we have in our Johns Island plan. It's a lot in line with what we had talked about from our comprehensive plan. So we felt very, very good about that. You know, we thought from a staff standpoint that everything was hunky-dory on this, and that this was, you know, something that the community would be endorsing, because we've heard from meetings on Johns Island that everybody's strongly in favor of the medical center and all that. And I think in general, the community is very supportive. But there was some very erroneous information that went out in the internet earlier this week. That had a number of inaccuracies that I think triggered a lot of the comments that you all have in your comment sheet. And I kind of want to get to that before we get to the comments, because there are things that were in that missive, and there has been somewhat of a corrective missive that has gone out, that went out yesterday at, I believe, 7:37 p.m. I'm not sure if it made it to all the neighborhood associations the way the first one did, but there were a number of things that were inaccurate in there. And what that dealt with is there were a lot of inaccuracies about public hearings and how public hearings are done in the city. There are always public hearings done in the city with rezonings and with plan unit developments. In fact, there are the exact same number of public hearings done in the city with plan unit developments as well as standard rezoning and a zoning. You all have a public hearing and city council has a public hearing. So the fact that there would be less public input on a PUD versus a rezoning is just not correct. Secondly, there was an implication that traffic studies are not given the same amount of attention in a planned unit development as they are in a standard zoning. Absolutely untrue. The same exact people review traffic studies within the city organization for planned unit development as review it for standard zoning, and it is the same requirements, same broad reach and analysis of that. So again, no loss by having a standard zoning versus PUD by virtue of the traffic studies. Then there was the implication that a PUD could be created for a medical district, when in fact you really can't if it's a single use. We can't have single use PUDs in the city. So it would have to be mixed use. The plans, and again, I don't want to speak for the HCA Trident folks, but they're going to explain tonight that what they're interested in is medical offices in a hospital. That's basically a single use PUD. So that's basically single use site on the site, and it would not meet the criteria for PUD being mixed use. And then finally, there were some other inaccuracies about the city development review process. Only the city of Charleston has design review for developments like this. If the areas that are to be annexed, as shown in crosshatch here, were to stay in Charleston County, the public would get zero input into the design of those buildings. Whereas if they come in the city and there's frontage of Maybank Highway, the public gets input in that. So actually the city has greater public input than the county does. It's not being critical of the county. It's just that the city has a very expensive and involved process that involves design and fee that the county doesn't have. That's one of the reasons staff is so supportive of this all being in the city, because we feel like that gets a much better designed area for Johns Islanders and for the city of Charleston. So I've kind of tried to set that straight. I hope that folks who might be here from Johns Island have understood what the inaccuracies were that were floating out on the internet there. I will be happy to answer questions about that further, but anyway, we'll see what the public has to say and what the applicants have to say on this. But in general, we're so enthused about what this would bring to Johns Island. We know that there's a lot to review, that there's going to be a lot of details that will be part of this. There'll be tremendous attention to the traffic impacts. There'll be tremendous attention to design.
Tremendous meetings forward too.
Absolutely, absolutely. There'll be tremendous attention to things like how we can integrate this site with a park that the city has recently bought. This is a passive park area right here. This is not a park that's intended to be a active recreation park. That's at the park that's at the Johns Island site with the play fields and things, but that doesn't mean there can't be trails, that there can't be all kinds of activities related to this park that could interrelate with the medical center. So that's another reason we think this is such a great location for the medical center. So anyway, I'm going to stop talking now, but I've tried to bring things together. I see Mr. Bailey's got a question here, but suffice to say that staff is supporting the rezonings here, as well as the new zoning and as well as the GO amendment to allow for hospitals in the
You're supportive of all three. Mr. Bailey?
I want to ask what I think is a clarifying question to try to simplify what you just said in
Sure.
a lot of detail. We're being asked to rezone approximately 20 acres that are already in the city.
Correct.
Number one. Number two, there are 27 acres that are not currently in the city. Those are in the county. And we're being asked to give those a zoning. So they want to annex and they want zoning. And those 27 acres, there's no public review process for those.
At present, correct.
For in the county, if they stay in the county. You didn't want to be critical, I will. We don't want that storage facility that wound up on West Ashley on this site. And then the third thing is you're asking for the ordinance amendment to allow hospitals to be in general office.
Yes, sir.
20 acres in the city, rezone it. 27 that's currently in the county, bring it in and zone it. And then allow a hospital in this, not business park, general office.
Yeah.
Okay.
I wish I'd kind of said it in that fashion because it's
Jacobs?
Just one additional clarifying thing you didn't mention is all these projects this side go through this extensive technical review.
absolutely.
And our stormwater guidelines are the most modern, and they would
Yes.
have to meet very modern stormwater management guidelines for
Some of the
50 some odd
most
acres.
in the country.
Yeah.
Absolutely.
Yeah, so that, I just wanted to add that to your list of things that this project would go through if it was on the city.
Slampus, you have anything? You look like you've asked something, but I don't want to catch.
No, I just wanted maybe Christopher to comment on the public hearing aspect. I mean, I think you said it, but we were repeating everything else.
Great.
It's basically the same number of public hearings, whether you're the type of zoning that y'all are reviewing today, or if it had been a planned unit development, same number of
And I
public
just
hearings.
want, because a lot of these remarks in there got the impression, like you said, that there was going to be no public hearings and we did not have any approval process in it. So by right, I think everybody got the by right.
Thank you. Any other questions, commission members? If not, Mr. Hellman, I think you're ready on.
Thank you, Mr. Parrish, and members of the commission. Brian Hellman, 105 Broad Street. First, I want to say thank you so much to Christopher Morgan, who literally took everything I was going to say and said it already. I'm here with Christina O, Sylvia Simmons, and Rod Whiting, all from Trident Health. And this is, in fact, an amazing opportunity. I mean, it is one that will certainly impact the lives of everyone, not just on Johns Island, but all of the Sea Islands, Kiowa, Seabrook, Wadwalaw, and all around, and truly affect the lives. In any project I work on, it's so great to learn about sort of what it does, how it will impact the area. And the numbers here are pretty amazing. I mean, there's no real healthcare opportunity like this that exists on Johns Island. And you'll hear some more about this later after I speak, but this will solve a very, very long-standing problem. One of the things that wasn't mentioned is that the property that's already in the county is already zoned for a hospital. So, you know, basically we all read, I think, 100 and something by right comments. In the county, we wouldn't be talking about making this, you know, a hospital allowed. It's already allowed. It truly is there. But in the meetings we've had with the city, it became abundantly clear to the folks at Trident to make the very best product, the best project, the best hospital, the best facility. All of these parcels need to be combined, and it would take it into the design review board and create those public hearing opportunities that don't presently exist. So right now, as you see, there are 4 parcels that are in the city. They're about 20 acres, as Mr. Bailey pointed out, 27.5 acres over 11 parcels, a total of 15 parcels. Those 27 acres are currently in the county zone. Maybank Highway Commercial Overlay. This project would actually create a 50-bed hospital. It would have 4 operating rooms, a cath lab, CT scan and MRI services, a 236,000 square foot project at a total estimated cost of nearly $300 million. In the certificate of need, which still exists for hospitals for a number of years, that's still a requirement. It doesn't go away. In the certificate of need, the community need documentation pointed out that the applicant, Trident Health, clearly identified its target population as Charleston County, specific to the Sea Island communities. And using population statistics that the state demographer used, the applicant's projections of anticipated population changes and are reasonable. And the assumptions used, they said, that determine the need for this hospital are very reasonable. Ultimately, they said the proposed project would meet an identified need. The state basically said there is an identified need for this project, and the projected project utilization, and this is, I'm quoting from the certificate of need, is sufficient to justify its implementation. So the state looked at this and said, yes, we need a hospital. So the timeline that Mr. Morgan spoke about is important. So in the certificate of need, in that process, it identifies a time in which all this needs to be developed. The certificate of need was just approved and is actually still within an appeal period. But once that is over, by the end of this year, an architectural contract is required. The architects have to be underway. By the middle of 2024, June 30th, they're expecting a construction contract in place. And by basically September 1st, September 1st of 2025, construction must be underway. So we are off to the races here. That's a very, very aggressive schedule that the state has imposed, but it identifies this need that the certificate of need actually spoke about. So I'm happy to answer questions about this project. Mr. Morgan has done such a wonderful job of explaining every little detail.
Any questions to commission members, Mr. Hellman? Mr. Hellman or Christopher, can you tell me, I'm just curious, and I probably should know, how many people live Johns Island, Kiowa, that area? Roughly, do you know?
I know in the city, we're up to like about 13,000 or so, something like that.
So in the islands.
Or more. I don't know, Brian, if you all have that figure.
I don't know those numbers, but what I do know, Chairman Karras, is that in the certificate of need, the estimate of the first year of operation of this hospital, they would expect 25,000 emergency room visits at this location. 25,000. So if you think about it today, there isn't an emergency. And there
There's
isn't
an emergency to get off the island.
That's right. And so the opportunity here is going to just cut the timing down to get to whether it's downtown or West Ashley or North Charleston.
I have one question. What's the distance between this site and the nearest actual emergency full-scale facility?
So Trident has a facility on James Island, a new facility that just opened.
Yeah, good afternoon, everyone. I'm
I think
here.
good point to share this.
If you come up and tell us
Sure.
for the record who
I
you are.
need my exhibits here.
This is Christina O, who's president of Trident Health.
Great.
So we have that it's 8 miles to the new freestanding ER that we just opened on Folly Road on James Island. 11 miles to MUSC and Roper.
Is that one on James Island, a full service emergency rooms and
It's a
everything?
24/7 emergency room,
Okay.
staffed 24/7 by board certified emergency physician.
Okay.
So 11 miles to MUSC and Roper campuses downtown, 13 miles to Roper St. Francis on West Ashley, and then 23 miles to Trident Medical Center's campus.
Thank you, ma'am.
But at the one on James Island, that one, I guess, does it have like an ICU or?
That's not a hospital, so
Right,
it really
that's
is,
what I was
it really is a freestanding ER intended to treat people.
They can't admit people anything
Yeah,
else.
if they're well enough, they send them home. If not, they stabilize them and then get them to the next best place.
Yeah, they'll have a heart attack.
For the next
Send them
best place
somewhere
of
else.
care and that distance from point A to point B would be, and you would be an 11-mile.
It's dependent on what's time sensitive, but yes, and we actually have 2 of our board certified ER physicians tonight here with us that are prepared. They worked at that site. They're prepared to talk to you about that. And yes, they make that call when things need to go downtown.
Great. Any other questions? Ms. Jacobs?
Are your plans for everything to be built out on site or for allowed for expansion as needs? Or-
So the way that we are designing the building in general, there's still a lot of specific architectural work that has to be done, but the plan is to expand from 50 beds ultimately to 150 beds. And when you think about also what a 150 bed hospital needs, we need ample parking as the site grows. We need more medical office building space. And that's one of the things that would happen outside of the certificate of need process, which we still want to clarify. MUSC has another week or so to contest the certificate of need that's been granted to us by the Department of Health. But more medical office building space. And then if we do decide with the community support that we would need to be able to have a helicopter landing there to take people to more critical care, we would need the space, ample space for a helicopter to land.
Thank you.
Great. Other questions, Mr. Bailey?
Mr. Hellman, have you read all the comments that were submitted?
Yes. I have read about every one of those comments, I'm pretty certain. And I read the letter that prompted those comments and I read the letter that attracted the letter.
Well, I mean, I really do. When we get these packages, I try to read everything that gets submitted, but when there's 193, we get these maybe 24 hours before the meeting. You get paid to read them. I don't.
Well, I got to read them last night after dinner. So,
All right, well, does that mean you don't send them a bill for that?
Perhaps.
I guess my question is, maybe this isn't appropriate for you, I don't know, but it seemed my read of this, I couldn't find anyone that's opposed to a hospital.
They're not opposed to a hospital. What triggered this is as Mr. Morgan said, a mistaken concept that a PUD would provide for a different degree of review by city planning and city planning staff. This for city council and others.
I mean, so many of these comments about the 193 in opposition, they start with I'm very much in favor of a hospital. They didn't like what they perceived to be the wrong process. That was my impression.
What triggered that is there was some language in this letter, and it said that let me find exactly where it is. He said that sorry, I didn't highlight it here. It said the proposed change would allow the developer to build the hospital by right with no input in the development process other than from city staff. And as certainly if we left it in the county, which there is a possibility if this didn't work the way we would hope that it would, that it could be built in the county. And that's in fact true, that it would just be county staff. One of the decisions that, we all had to discuss was going into the city, annexing into the city requires it to go before the design review board. And given a project of this scale, I suspect it won't just be the conceptual and preliminary meetings. There will be a number of those meetings, and each one, the public has an opportunity to come and speak just as they do here. So at a very absolute minimum, there would be 4 opportunities for the public, this being the first. The next meeting at city council, where there's a public hearing, would be the second. And then there would be a minimum of 2 design review board meetings. But given the medical office complexes, which are going to be separate from the hospital, my guess is there'll be more than a half a dozen design review board meetings to address each of those projects.
Any other questions, Mr. Hellman? Not Mr. Hellman, we appreciate it. Thank you for your good work.
Thank you, Chairman.
Is anyone here in support of the application? If not, anyone here in opposition to the application? You'll come on out and tell us who you are.
Good evening. Thank you all. My name is Scott Hayes. I am a resident downtown Charleston, Wagner Terrace, and I'm a board certified emergency physician. I currently serve as the medical director of emergency services for Trident Health, as well as the chief of staff, where I've had the honor and privilege of practicing for the past 15 years in the emergency department. When we talk about why a hospital is important for Johns Island, we think about access to patient care. As the population increases in Johns Island and the surrounding area, there's a dire need for quicker access to emergency and overall health care. In most circumstances, such as stroke, heart attack, trauma, time is of the essence. And there are many areas on Johns Island, Guatemala, Kiowa, Seabrook that can take up to an hour, if not more. I believe this morning was an hour and a half from some of those areas just to receive medical care. This hour can be the difference in life and death, and that's no exaggeration. With our proposal, we are anticipating of seeing, I believe they said 25,000 plus emergency care visits. These are life and death situations. It is imperative that we be able to provide the needed emergency care to the population of Johns Island in an efficient and timely manner. And the only way to do this is to build an ER and hospital on Johns Island. I want to actually introduce one of my fellow
Just to clarify, you folks are supportive of the application.
Absolutely.
Okay, great, because that's information.
And we're going to be staffing it.
Okay,
So this is Dr. Lee Catherine Moore, who's one of my board certified ER physicians, who's actually a resident of Johns Island. So she is in the area.
thank you. Yes, ma'am.
I'm Catherine Moore. I'm an emergency physician. I've been living on Johns Island for almost 9 years now. My mom lives on Johns Island with me. She's 79. My sister and my husband also live there with me. We live down River Road. We used to live in the city off of Maybank. Now we live in the county, so we don't really get to vote on a lot of these things that affect us so much, right? I think there's been overwhelming need for a hospital since before I got there, honestly. And when Dr. Hayes told me that HCA would build a hospital there, I was super excited. Not just because it was going to reduce my commute off the island, but also because we really need it there. My mom just moved down here over the last year. I worry about where she's going to go in an emergency. You say 11 miles or 13 miles, that's 13 miles could be a half an hour one day, or could be 2 hours another day, depending on whether the Walkley Bridge is up, what the traffic looks like, whether school is letting out, all those things really matter. And time is of the essence when we're talking about an emergency. As a Johns Islander, I also understand, I'm on all of those Facebook sites, the Johns Island United, Johns Island Unfiltered, Johns Island Friendly and Useful Site, all of them. And they all talk about the traffic and everything that's happening on the island, which has been awful, quite frankly. I mean, it has been awful. And I feel like there's a lot of skepticism in general by the residents. And so I think when any amount of information gets out that isn't correct, it kind of runs wild on the social media, and everybody wants to jump at any outsider that's coming in. And God forbid if you're from Ohio, because if you're from Ohio, they will not like you. From Chicago, they seem to be okay with Chicagoans. But so I understand the skepticism, but I just can't believe there would be any opposition to this. I'm so excited that we're going to have a hospital.
Great.
So I am strongly
Thank you.
in support.
Thank you, ma'am. Yes, sir.
Yeah, thank you, guys. My name is Chris Childress. I'm the oncology administrator for Trident Medical Center. I've lived out on Johns Island off Chisholm Road for about 13 years. I've lived on Johns Island when it was one lane to get on the island Then we got a little slit, a little pitchfork, so I've been there long enough to see the changes of Johns Island. And I had a big discussion about, falling within the urban boundaries and how that growth perspective looked. And I've lived out there long enough to know that traffic has been an issue out there. I had an issue to bring up about the infrastructure and the people who live out there that I know that are nurses, that are doctors, that could work from home. Literally drive down the road instead of having to drive over 3 bridges and battle the traffic at the turn lot right there at Maybank and River. I had all that written down, but I'll leave you with this. My daughter is 7 years old. She cheers and does gymnastics at 77 and Sunny on Maybank Highway at 5 o'clock. If she was to fall and break her hip or something like that, like I would probably be going through hell and high water to try and get her somewhere. And getting her somewhere would be very difficult. And I probably tipped off a lot of people by me trying to get her there.
Yes, sir.
So I'll leave you with that.
Thank you.
Thank you very much.
Thank you. Let me just say, I hope everyone
memories of trying it, but if we can, I don't want to turn over all design just to those guys. I think there should be some local input from Johns Islanders. The reason we have terrible traffic, by the way, is because we only have 3 lanes getting off the, on Maybank. We should have 4 lanes, but we like those oak trees, right? Because we want Johns Island to look like Johns Island. But if we're gonna have crappy traffic, let's also at least have a beautiful building in this build, okay? So can we please have local input? Let's not just turn over design to those guys, okay?
thank you, sir. Thank you. And I believe that Ms. Morgan said this is going to be a design review board and things like that.
Any of the parcels that have frontage on Maybank
So I
Highway.
think we'll get some
Or under
feedback and
design.
input as what the building looks like. So thank you. Anyone else in support of the application? Okay, anyone in opposition to the application? Okay, great. Yes, ma'am, come on up.
I've never been in this position before,
That's all right.
but I'm standing here. My name is Ellen Silver. I thank you for listening to me. I'm standing here with many of my neighbors standing behind me who are worried and upset, not about the presence of a hospital. I was Harvard Medical School faculty for 30 years and worked at a lot of big hospitals in Boston. What I'm worried about is the destruction of the trees. Yes, I do care about the trees. And also the traffic worsening. If you're at Fenwick Hall and you're going to try and get to the hospital, depending on what time of the day it is, neither you nor an ambulance are going to be able to make it there in any really good time. So I know that you've talked about improving the roads. I don't know what that means. To me, that could mean anything. And I live behind Cane Slash. And I live on Johns Island because I like Johns Island. Yes, I do. So I am worried about all of those things, and the hospital may be great, but it's going to need parking. We have no infrastructure to get staff and patients to the hospital at all. Even if you live at Fenwick, I thought about starting a bus system myself for people that are going to be moving into Fenwick and work at the medical systems downtown. we don't have any infrastructure for that. So if you're going to go ahead with this project, please do make the design of the building attractive. If you're going to expand it to 150 beds, please consider parking and traffic.
No, ma'am, and we appreciate you coming out. Not everyone's always supportive of things, but we appreciate your input and your thoughts too. So thank you for coming. Anyone else like to speak in opposition? If not, Mr. Hellman, would you like to say anything that you know about, and Christopher, about any kind of road improvements that may happen? I know it involves the state and the city, so it's not easy.
It does. I know there'll be some improvements. I think some of the improvements that we'll see from this is that of those 25,000 people that have emergencies on the Sea Islands for the certificate of need, the good news is they're not having to drive into West Ashley and over the bridges. So we may see reverse commuting coming to the hospital. We'll see people who don't have to leave the island who will be able to use this and not have to fight the traffic. So I think it perhaps could improve traffic. I'm not a traffic engineer, but that's what we understand. Thank you.
Great. Thank you, Mr. Hellman. Appreciate it.
There's one more. Am I allowed to add one more?
You can come on up if you would, just for the record, and just say your name again.
Yes, Christina O, the CEO at Trident Health. One thing that is a good option to help us improve traffic, and this was reported in our certificate of need application, but I think it's an important fact for everyone here to know. As a health system, which is, multiple facilities caring for people in the Low Country, we're the only tax-paying health system in the Low Country. So the estimated non-income taxes in the first 3 years of this hospital being in operation is $10 million into the community. And that $10 million is not specifically alone to solve traffic issues, but being able to pay taxes and support the infrastructure of Johns Island is something that we're here and prepared to do.
Thank you. Thank you for that additional information. Mr. Bailey, you got a question?
I just want to ask Christopher.
Let me ask one thing. This will close the public hearing aspect of this. So Ms. Bailey, you go ahead.
Just for the portions that are currently in the city, leave off the county for a second, but whether they are, I think it's business park now or general office, does that impact at all how we review things like trees or traffic or anything of that nature?
Well, it's the same whether it's general office or business park or.
That's what I wanted to
Tree
clarify.
regulations are the same, the traffic study requirements are all the same.
So rezoning a property that's already in the city from business park to general office has no impact on the outcome of how those trees and traffic and so forth get dealt with.
Same regulations.
Okay. Ms. Harrison, you have a question?
No, I don't have a question. I have more.
Okay.
Are we taking comments or questions?
Yes, ma'am. Comments, questions, motions, go ahead.
So I think it's been almost 13 years ago. I was sitting in a VAR hearing and my mom called me repeatedly and I could hear the ambulance in the background.
A horrible feeling.
It is a very horrible feeling. But that ambulance was leaving our house in Somerville to go to a hospital in Somerville. And so to have that extra time was critical, even though the outcome wasn't the outcome I wanted. But to have that extra time, to have that bed, to have the ICU there was important to my entire family that's based in Somerville. So healthcare outcomes are critical, from getting from Johns Island to the CI, because it's actually technically a rural community. And so people don't think of Somerville as being rural, but when you didn't have, before it didn't have a hospital, it didn't have any beds. So those things become important. They help you thrive, they help communities thrive. And so I understand the concerns, but in this particular instance, I think their need is very great and we have an obligation to help communities meet those needs. And so I am going to recommend approval.
Great, thank you. I hear you, and I tell you, that's one of the reasons I asked about the population. I can't imagine how many folks live over there without a major hospital. I mean, it's just, they got a city over there and it's important. Ms. Jacobs?
Mr. Chairman, are we gonna motion these separately or is?
Well, I'm gonna let Mr. Lassane, he has an idea, so I'm gonna, unless you have a comment, go ahead.
I was gonna make a motion
Go ahead.
to approve rezoning number 2 at 3037 Maybank Highway. Also to approve as a part of my motion, ordinance amendment number 3.
Number,
Yes, number 3. And then zoning number 2
I think Erica thought that-
for all the reasons that have been
yes,
stated.
so there's one motion. And we list all 3 items in the motion. Is there a second to the motion on the question?
Erica tries to move.
Let's
So
let-
let's let Erica do that.
Yeah, I'll second the motion.
Ms. Harrison, so the motion by Mr. Hussein to approve rezoning number 2. Ordinance amendment number 3 and zoning number 2. Other questions or comments? Or not, all in favor of the motion, signify by saying aye.
Aye.
Anyone in opposition? So we have 7, correct? 7 in favor, none opposed. Thank you. Thank you all for coming. We appreciate your work.
Thank you.
And we hope we don't need the hospital, but we're glad it's coming. Next item on the agenda is rezoning number 3, which is 162 Ashland Avenue, TMS number 4601, 504061, approximately 0.25 acres.
That's the bird. 160.
Sorry, I apologize. Okay, so we had 2. Okay. So the next item on the agenda is the plan unit development. Number 1, Daniel Island PUD amendment. Daniel Island request amendment to Daniel Island Master Plan, request 3.24, Daniel Island General Office, Digo Zone. Ms. Park, correct? Mr. Morgan?
I'm gonna go over this.
Okay, go ahead.
Mr. Batchelder has met extensively with Mr. Wilson, and Mr. Wilson's going to be presenting this for the applicants. It's not a city application here. This is from the development team that's doing some of these projects on Daniel Island, but I have some bullets from Mr. Batchelder to kind of explain. So retail and restaurant uses are permitted in the Daniel Island General Office Zone as accessory uses to office uses, provided that no individual store exceeds 2,000 square feet. There's no drive-through or drive-through service. This amendment that is before you to the PUD would permit restaurants and retail uses that exceed 2,000 square feet and do not have drive-in or drive-through services. Permitted principal uses in the Daniel Island Geo Zone by inserting the language in proposed ordinance at the end of the list of Daniel Island Geo permitted uses. The proposed ordinance sets limits on the size and location of restaurants and retail uses, including that the buildings must not be within 1,000 feet of any property zone DI residential. This would limit opportunities for these uses in the Daniel Island Geo Zone to the former Blackball Soccer Stadium properties. And with that, staff is recommending approval on this. The ordinance, we've got it here. Mr. Wilson can walk you through it well.
Good, Mr. Wilson, come on up and tell us about it.
Thank you, Mr. Chairman, members of the planning commission. I'm James Wilson, Lovell Dickinson, here on behalf of the applicant. My client's Holder Properties, which is redeveloping the Blackball Stadium and office building site. The status, I'm going to just give you a sense of that redevelopment. So as many of you maybe have seen, the old Blackball office building has been totally renovated. And it is occupied now, and more tenants coming in, and it looks great. So that office component, of course, is already there. And then what was just a vast parking lot with a soccer stadium in the back, that's being redeveloped with a combination of residential and a new park. And the idea is to do some restaurant and retail as part of that also. So to turn it into a real mixed use project, and it's, Knoll Creek comes down that way, so it's being called Knoll Creek Village. So this is an amendment to the Daniel Island Master Plan PUD that you all are all familiar with. And the idea really here is to try to activate this area around the park, and the park area is going to be a waterfront park area that's under the Daniel Island PUD language. It's called a focal point park, and that of course will
be publicly accessible. That'll be a public park area, and it's marshfront, waterfront there. And as Mr. Morgan was explaining, restaurant and retail are already permitted under DIGO, which is what we're zoned. But they're kept to very, small sizes of 2,000 square feet. So the idea is you could have some sort of like small little ancillary pieces. What we're asking for is to amend the PUD to allow more substantial uses along those lines. Most of our restaurants that we're all familiar with are significantly bigger than 2,000 square feet. The Daniel Island Master Plan was adopted. We're right at the 30-year anniversary, 30 years ago. 93. Isn't that hard to believe? There was no Daniel Island or no development. We've talked a little bit with Mr. Morgan, Mr. Batchelder, about, well, how did DIGO come to look like this? And what we talked about a little bit is, well, it was a different era, right? 3 decades ago. And the DIGO, Daniel Island General Office District, was really envisioned as more of, what we think of today, the suburban office park. And, the suburban office park might have a little, little something, restaurant of some sort, but that's what the idea was. And I think all of our thinking has evolved a little bit on that, and the idea, no, actually you can have real mixed use in some real activated areas with residential next to office and with some real restaurant and retail and park and these things. So in a sense, I think we're kind of updating 3 decades later, how planning and thinking about good urban design has evolved a little bit here. I think all of us reflect regularly on, it's a little bit surprising in the Charleston area where we're surrounded by water, that we have relatively few waterfront restaurant opportunities. And I think the best analogy to what we're talking about here, this would be a significantly smaller scale, but over on the Wando side of Daniel Island, there's the waterfront park with a relatively new Kingstide restaurant, and also a to-go food place there where people can get food and take it out of the park. And so this is a little bit of maybe, I think of this kind of a smaller scale version of that would be enabled and allowed with this PUD amendment. We've got the, should be in your packets, support letters from the Daniel Island Town Association and from the Daniel Island Company, which is the declarant under the development agreement, and the PUD. And then perhaps most, as importantly, at least now, the Daniel Island Neighborhood Association, DINA, they submitted a comment. We've had our team holders had multiple meetings with them. And their concern was, we want to make sure that this couldn't, we're fine with it here, what you're proposing over at the Knoll Creek Village. We just want to make sure that it doesn't get replicated anywhere too close to the residential area that would concern the neighborhood association, and totally respect that. So that's hence the introduction of 1,000-foot minimum distance from a residential, a Daniel Island residential neighborhood, meaning zoned residential. Obviously, we're doing residential, which will be a combination of townhouses and various things, but so we can be within 1,000 feet of that. But any area that's zoned DIR, Daniel Island residential, we can't be within 1,000 feet of that. So we think through a lot of interaction, we've worked out a good kind of combination of limiting factors here. We've got it. This is only for parcels that are adjacent to a waterfront focal point park. So the idea is to do it right around a public waterfront park and 1,000 feet away from any Daniel Island residential. I think that pretty much covers the thing, the selling points that I've got, but I'm glad to talk about it.
Any questions, Mr. Wilson? Thank you. We appreciate it.
Thank you.
Would anyone like to be heard on this item, either in favor or opposed? I didn't think there was, but we'll ask. So thank you.
Well, I'd like to move for approval, and I think you were with me, Mr. Parrish, when we went to, on the bus trip to Daniel Island, when it was nothing. So, it was.
You voted on the original master plan. Yeah.
I know, we were trying, yes, I was in one, I was left alone at the front of the, at the front of the auditorium with the board. No, but the master plan, I mean, we really, it was a very difficult concept to come to terms with this vacant, large, massive land to try to plan what is now Daniel Island. So I'm surprised that we haven't had to amend more things. Very honestly, I think the city staff did an incredible job of getting us out there, explaining it to us. And so I get that we had to change a little bit of what, and I perfectly understand that. I'd rather see something interesting than the parking lot. And so
there's a motion by Ms. Lampasas. Ms. Bailey, you had a question or?
When you were on that bus trip in 1993,
tell me where you were.
I was on a bus trip to a high school game. But I'll,
You just had to rub that in.
I assaulted the.
I was a senior in high school and I'll second that motion.
Okay, so the motion by Ms. Lampasas to approve plan PUD amendment number 1. Second by Mr. Bailey. Ms. Jacobs, do you have anything or?
I was on this bus trip too, so be careful.
I think you're closer to him than I am.
But I actually. In serious,
And the fact that you seconded it and having worked there for so many years, I'm honored. that you
Well,
actually agree with me.
I was gonna say that I when I read all of these words. It's like, what are we trying to do here? But Mr. Wilson took me on this trip down memory lane about that office park zoning classification that really does seem kind of outdated today.
It was a great idea 30 years
There's
ago.
a motion by Ms. Lampasas,
And that's
second by
what-
Mr.
that's what I
Bailey.
was
Any other
gonna say.
questions or
I'm
comments?
Thankful.
If not, all in favor of the motion, signify by saying aye. Anyone opposed? That's 7 in favor, none opposed. Thank you, Mr. Wilson. Next one, I think, is Ms. Harp. So it's commercial subdivision. It's 2620 Plymouth Ferry Road, town at Cooper, Kinghorn, that's number 271-000-1035, for approximately 30.14 acres. West zone, request subdivision of 8 lots and 2 front roads right away. So far.
Okay, so the applicant is requesting a subdivision concept plan approval for a little over 30 acres on Clemens Ferry Road. And it comes to you because there's a right of way and it is more than 4 lots. So 5 lots or more, it will come to planning commission. The project will consist in the creation of 8 parcels. 2 of those parcels will be right away. Okay.
Yeah.
So there's like so the parcels right here. And the 2 rights away here. The 2 parcels the 3 parcels that we see hatched with red, those have already, this 2 right here at the bottom. Went to planning commission back in 2018. That's for one of the parcels is for a proposed fire station. And the one on the top, left, that one is going through plat review committee separately as it's only for 1 parcel. This is what is going to result at the end of all this happening, but just wanted to clarify why those parcels are shown in there, but they don't have anything to do with this parcel, with this proposal. Let's see, there are no wetlands on the parcel. There are grand trees on the lot, and they will be reviewed as they come through TRC individually. So they will have to come back. This is again, the concept plan, just for the number of lots. The majority of the surrounding properties are located in Berkeley County. As I said, they will have to come back to TRC for preliminary plat and road construction plans. And then each individual lot will come back to TRC for whatever they want to do. And at that time, the trees in each lot will be reviewed. And if necessary, they will go through the Board of Zoning Appeal site design process. At that time, we will also make sure that the plans comply with all the city codes. And as you know, they will comply with the 2020 Stormwater Design Standards Manual.
and will be approved only if they are found to meet all the requirements. Right now, TRC has reviewed the concept plan and approved the concept subdivision plan for compliance with the city standards, and staff recommendation is for approval. And I think we had a newer version that at the request of staff, they added a future, like an easement on this area, so there will be a future connection for, planning for the future, so.
Right. Thank you, Ms. Hart. I guess is the applicant here? Anyone like to speak? Yes, sir. Come on up, tell us who you are.
Good. My name is Spencer Club, I'm the team of Whiteside. And I've worked on this project for quite some time. And it's been a great job of explaining it. So this request is for 6 additional parcels and 2 private roadways. And the private roadways are kind of dashed in blue on the screen. And like she said, the properties that are hatched have been approved or under plat review currently. This request is also just for subdividing and the use for redesign. And then after conversations with city staff, Eric, we have incorporated the easements to provide connectivity between the adjacent parcels. Also to note, the roadway infrastructure plans have been going through the TRC process for the last kind of year and a half. And there is a stoplight plan for this development to improve, the safety along Kingsbury, because this intersection is right at a big curve, kind of close to 526. And there is a huge need for the fire station in this area. And this will provide a partial upgrade discount and the subdivision of the properties needed for the fire station development.
Great, thank you, sir. Would anyone like to be heard on this item? If not, that'll close the public aspect. Mr. Members, questions, comments, motion?
For approval.
Ms. Lamps, let's move for approval. Say second. Mr. Same seconds. Any other questions, comments? If not, all in favor, signal saying aye.
Aye.
Anyone in opposition? 7 in favor, not opposed. Thank you for coming, sir. Next item on the agenda is ordinance amendment number 1. And then section 54-241 of the Code of City of Charleston zoning ordinance since that penalty for the intentional demolition of structures without required approval. Mr. Jacobs, were you behind this? You behind it, anyway.
Listen, DAR.
Yes, ma'am.
DAR,
Good evening.
not
So,
DRB, Mr. Chairman.
yes, this is for.
This
for
is
VA.
DAR.
Yeah, no,
We'd like to move it to
No.
DRB.
yes, ma'am.
This request came to us from city council. We've seen a number of after the fact approvals for demolitions. Unfortunately, it seems folks like to take things in their own hands when they get a decision that they don't like. So we worked with the planning department to create some specific penalties when this occurs. And I guess because we use the phrase rebuttable presumption, it falls on the lawyer. But the general idea is that if a structure has sought a demolition approval and been denied, and within the next 5 years seeks after the fact approval, it creates a presumption that it was intentional. And then the burden falls on the applicant to show that it wasn't. And there are a number of ways that they can show that it was not intentional. The first would be credible evidence establishing to the board that significant and material further deterioration of the structure was not occasioned by neglect and occurred after the denial of the prior application, and that such further deterioration was caused by circumstances beyond the owner's control. And the other instance would be when good faith efforts to prevent further deterioration of the structure were undertaken after the denial of the prior application. And the present condition of the structure indicates those efforts were significantly and materially frustrated by circumstances beyond the owner's control. So when the board finds that evidence was not sufficient to rebut that presumption, the owner will then be subject to penalties under 116 of the code, which is a $500 fine and or up to 30 days in jail. And in addition,